Good afternoon and welcome to this community briefing on our ongoing pandemic response efforts. Providing interpretation for us today is Margie Prop. Thank you, Margie, and thanks to everyone for joining us to learn about the latest local developments. Over the last month and a half, we focused on two proven disease prevention strategies, vaccination and masking, to protect our community and help us get through this surge driven by the Delta variant. It's clear that these strategies are working and the data is showing continued improvement in our local situation. I want to thank our residents, schools, and businesses for masking up and moving us forward. The chart you're looking at now shows the consistent and controlled drop in cases that started shortly after the indoor mask requirement was implemented on August 26. The daily case average has decreased 46% from the peak of 139 cases per day on August 29th to 75 on August 7th. Since the implementation of the mask mandate, we have continued to monitor data indicators and review the impact to our local situation. Nearly all the indicators have shown improvement. We need to see a sustained average of daily cases in at least the 40 to 45 number range before we can consider changes. The positivity rate has not been declining at the same pace as the cases, but it has dropped from about 11% at the beginning of September down to about 8.5% at the end of last week. Positivity rate is an important indicator for us about the spread in the community, and we need to see it in the 5 to 7% range. That would indicate that the risk of transmission is lower. Our situation in Lancaster County is different than in many other areas of the state, and we are fortunate to have our case numbers going down. As I communicate with other health directors, many of them are still seeing cases, numbers, and hospitalizations rising. Others are seeing numbers drop, but not to the same extent as here. Since some data dashboards were removed and then brought back in, it's harder to compare the data. Our close neighbor, Douglas County, is one of the health departments that has maintained its dashboard, so we can do a better comparison with the most recent data available. When you're looking at this chart, after the Delta variant began impacting our community in July, we peaked in the number of new cases in Lancaster County the week ending September 4th at 1,024. Since then, we have been seeing steady weekly declines down to about 589 cases the week ending October 2nd. This represents a 43% decrease in weekly cases, and that is indicated by the bottom blue line on the chart. Over that same time period, Douglas County experienced a much more modest decline. That is indicated by the red line. Cases declined from 1,406 to 1,119 cases. This is about a 20% decline compared to the 43% decline in Lancaster County. Throughout the pandemic, our department has taken thoughtful, measured steps based on local data to show the spread of the virus and save lives. This strategy, along with the actions we've taken together as a community, continue to serve us well, and we need to see this progress move forward. Our local hospital capacity remains a serious concern. The 7-day rolling average has stayed fairly flat for more than a month now. That average has been around 100 patients per day. At the end of last week, we did begin to see a decline down to an average of 96 patients per day. Today, the hospitals report 108 COVID-19 patients, with 59 of those patients from Lancaster County. Deaths due to COVID-19 are also a delayed indicator. That's why we may see an increase in deaths while other indicators continue to improve. With every death, a family loses a loved one, and we lose another member of our community. So far this month, we've lost 12 residents. That includes 5 we're reporting today. Out of the 12, 8 were unvaccinated. And as we look at the indicators that are used to determine the risk dial, almost everyone has improved over the past few weeks. We currently have no indicators in the red category. However, we do have 4 key indicators in the orange: case rate, death rate, positivity rate, and hospital capacity. 2 other indicators continue to be in the yellow category: contact tracing and the vaccination rate. And we do have 1 indicator that is just on the border of green and yellow, and that's testing turnaround time. After reviewing all the metrics together, the risk dial is moving out of the orange and into the elevated yellow category. This is the first time we have been in yellow since the week of August 10th. The current position of the dial is indicated by the blue square outlined in red, which can be seen on the chart just on the border of orange and yellow. The yellow category indicates that the risk of the virus spreading and the impact on our community is moderate. Our numbers are trending in the right direction, and we are very encouraged by the pace of our progress. However, the number of hospitalizations and deaths are still of great concern. We ask for your continued patience and perseverance as we work together to further reduce the risk of COVID-19 spread in our community. And of course, the second proven public health prevention strategy we focused on to protect our community and help us get through this Delta-driven surge is vaccination. Those who are experiencing some of the most severe outcomes due to the Delta variant are people who are unvaccinated. We're fortunate to have safe and effective vaccines that offer strong protection against severe illness, hospitalization, and death. And we urge everyone who is eligible to get vaccinated. We're currently at 74.4% of Lancaster County residents aged 16 and older now fully vaccinated. When we look at the vaccinated data for all Lancaster County residents, 60% are fully vaccinated. 20% of our total population is now eligible for COVID vaccine, but we remain around 65,000 who can be vaccinated that aren't. The darker green wedge on this chart represents the 5 to 11 age group, which is an estimated 9% of our population, or 29,000 children, who would be newly eligible to receive vaccine if it is approved. Pfizer recently asked the U.S. government to allow the use of COVID-19 vaccine in children aged 5 through 11. If the Food and Drug Administration authorizes emergency use of the vaccine in children, an advisory committee for the Centers for Disease Control and Prevention will decide whether to recommend the vaccine for kids, and the CDC will make the final decision. We met with local pediatrician and other partners and are working on plans for providing vaccine to children in this age group if it becomes available. And joining us today by Zoom to share further information about the impact of COVID-19 in children and vaccine is Dr. Sean Jones-Jobst, a pediatrician and president of Complete Children's Health in Lincoln. Thanks for being here.
Thanks for having me, Director Lopez. I appreciate it. It's been a difficult couple months watching this Delta surge because what we have seen is it's impacted children more than previous surges of the COVID variants. And so we've been seeing more cases of COVID-19 in children, yet at the same time, we've also been able to vaccinate our adolescent population, which has helped to lighten the load a little bit, you could say. It's been very gratifying to see children and adolescents 12 and up go back to enjoying safely a lot of the activities that they were held back from during the early months of the pandemic. I've seen lots of pictures of homecoming and sports and dance performances and things, and it's very heartening to see kids participating in those things that are so important to them and back to school. Luckily in Lincoln, we've been back to school for quite some time. So it's important to remember that COVID-19 is, although tends to be less of an issue in younger patients, it still does have an effect on our youth. We've had over 6 million children and adolescents in the United States who have contracted COVID-19 at this point, and over 600 deaths in the United States. And those are children that didn't need to die from COVID-19. And hopefully soon we'll have a vaccination to protect kids as well. I wanted to talk a little bit about the process for how that vaccine will be approved, if it is approved. As you mentioned, Pfizer has submitted their application for EUA to the FDA, and the FDA will take a look at that. They've scheduled their meeting to look at that on October 26th. And once they've taken a look at the data and made a determination whether or not that will be authorized for emergency use, then the CDC will make the final recommendation for who and when and how. The dose, what we know so far is the dose will be about 1/3, I shouldn't say about, it will be 1/3 of the dose that we're giving to adolescents and adults. And it will also be a 2-dose series. And we believe, we don't have confirmation of this yet, but we do believe that it will be a different vial. So we may not be able to use the vaccine we currently have, but hopefully we'll have vaccine very shortly after it gets authorized. They make the decision. The committees that make the recommendation for authorization for the COVID-19 vaccination are committees of scientific experts who are advisory committees for both the FDA and the CDC, and they're made up of immunologists, infectious disease specialists, epidemiologists. These are people who do research, study research, and look at research all the time. And they ask really, really good probing questions when they do these analyses and when they make recommendations. I learned a lot from watching their meetings, which are open to the public. When they were looking at the booster vaccines, for example, it's actually heartening to see the questions that they ask and know how seriously they're taking these things. And so I think we can all trust that they will make the good decisions for our youth. And hopefully, if it does look like it's safe and effective, we'll be able to offer that to our patient population. I hope that parents know that if they have questions about COVID-19 vaccination, they can reach out to their pediatrician, to their family medicine doctor. We're happy to take those questions. I'm getting those questions on a daily basis in the office. And most of the time I tell my patients, we're still waiting to hear more, and we will let you know when we know when it's going to be available and what the data looks like. So fingers crossed that we'll have an opportunity to vaccinate our younger population soon.
Thank you so much for joining us today. We really appreciate the work of Complete Children's Health and the other pediatric practices throughout the pandemic to help keep our children in our community healthy. Whether it's children or adults, ensuring people who are unvaccinated have ongoing opportunities to receive vaccine remains a top priority for all of us. We will keep working with partners to host clinics that are accessible, convenient, and close to home. People in our community are getting vaccinated every day. Some are starting with the first dose, others are coming back for their second dose, and certain groups of people are now enhancing their existing protection through a booster dose of COVID-19 vaccine. Close to 5,700 people have received booster doses at clinics we've held with our partners. The Centers for Disease Control and Prevention approved the Pfizer booster dose on September 24th for people 65 and older and residents in long-term care facilities. People aged 18 to 64 with underlying medical conditions that put them at a high risk of severe outcomes from COVID-19 also are included, as well as people who work for or live in a setting where they have increased exposure to COVID-19. Right now, the booster dose recommendation only applies to people who have received 2 doses of Pfizer vaccine, and the booster dose is given at least 6 months after the second dose. We're using an approach similar to the initial rollout of COVID-19 vaccine, moving through the age and priority groups and stages. We're providing booster doses through designated booster clinics and some neighborhood clinics. We held 2 larger booster dose clinics last week at Pinnacle Bank Arena, and there were 3 in the previous week in partnership with CHI St. Elizabeth. We're currently offering booster doses to people 65 and older and first responders. We are adding a booster dose clinic for educators and child care providers later this week and through next week. The health department is contacting people in these age groups to schedule appointments. We're also working with community partners to provide booster doses in addition to first and second doses at some upcoming neighborhood clinics. Booster doses for people age 65 and older will be offered at a clinic this Wednesday, October 13th at Mount Zion Baptist Church from 4 to 6 p.m. and at a clinic at the health department this Friday from 7 a.m. to 4 p.m. Of course, booster doses are only for those who receive Pfizer vaccine. Potential booster recommendations for Moderna and Johnson & Johnson vaccines are still being determined. An FDA advisory panel is meeting later this week to consider booster doses of both types of vaccine. We are monitoring new developments closely and will provide more information as soon as it becomes available. As well as our work, several local pharmacies are also providing Pfizer booster doses to all ages and groups who are eligible. You can find a pharmacy near you at vaccines.gov or by texting your zip code to 438-829. Overall, we're seeing continued improvement in our local situation, and we're encouraged by the pace of our progress. Wearing a mask, getting vaccinated, and other preventative efforts are moving us forward as a community. However, the number of hospitalizations and deaths, as I've said before, remain a concern. We still need to see sustained declines in certain indicators and ask for your patience and perseverance as we work together to get us where we need to be. And with that, we'll take any questions.
Director, this is Bill Shamert with 1011. How are you today? I had a question about that goal of getting down to a case average of 40 to 45. Do you think that's a realistic possibility given that the mandate is set to expire right now in about 2.5 weeks?
You know, Bill, we're seeing things drop, but, you know, it's really hard for me to predict that at this point. I'm not sure that we'll be ready by that time, that we'll be down to that 40 to 45. But our numbers have been dropping pretty dramatically.
Hi, Pat. It's Matt Olberding with the Journal-Star. I have a couple of questions for you. One, about the mask mandate. It's been in effect for a little over a month now, I think month and a half maybe. Are you running into situations? I've heard a lot of anecdotal evidence about incidents at businesses with people getting angry when people ask them to put on a mask. And I know there's not a whole lot of city enforcement going on because there's sort of a hesitancy to get the police involved or anything like that. But from your opinion, is the mask compliance this time around about the same, better, worse than it was when we had the mask mandate before?
You know, Matt, we do have people either that call us in or send us an email, and we do follow-up, and then we follow up again. And I think, you know, there's what we're seeing is fairly good compliance, but we know that some individuals, it can be challenging, and some individuals, perhaps outside our community, aren't aware or choose not to follow the mandate. And so then we work with those groups and try to provide information and education.
Thanks. And I had one more question for you just about the hospitalizations and deaths, the numbers continuing to be really high. I've spoken to a couple of doctors who just talk about how frustrating it is to have all the people in the ICUs, many of whom are unvaccinated, many of whom I'm even told refuse treatment because they don't think they're that sick. what would you say to kind of, the general public, the health providers, just about, what needs to happen, or how we can sort of all get through this? Because from what I hear, it's not a good situation in the local ICUs.
And that's true, and I mentioned it briefly in my notes about outside of our area. Most of those places are seeing a greater uptick in cases, and a smaller, a real great difficulty in getting hospitalizations. One of the health directors contacted me this afternoon in an area close by here, and they had a gentleman that had to go to a critical access hospital and was worked on for a long period of time, but they were unable to find the urgent care that the individual needed for life-sustaining treatment, and the individual passed away. So I think we're seeing a lot of that, and what's so discouraging is that when we see this, it's primarily the unvaccinated, and we're seeing so many younger people. When we talk about the 5 deaths today, and we say these deaths, and I think every time we should be remembering this is an individual from our community. It's somebody's loved one, and that shouldn't be taken lightly. That just because we've been reporting these for a period of time, that somehow I think sometimes we've gotten used to saying that. 2 of these people today are in their 50s, and they weren't vaccinated. They're leaving behind family members. We have thousands of children who are now without a parent, a caregiver, and this is all over not getting vaccinated. This is a health issue, not a political issue. And among the other cases today, one of the people was in their 70s and 2 were in their 80s. And one of the people in their 70s and an 80-year-old were vaccinated, but all the other individuals were not vaccinated. And even though we may get COVID, you're going to stay out of the ICU and be needing that treatment. And I look at what's happening, and I know I hear sometimes, and we heard Russ Grenwell talk last week, our hospitals have to accept these patients that come if they have space. This morning, I was visiting with Brian. They had 23 patients in the emergency department. Actually, it was more than that, waiting for a bed. They weren't all COVID patients, but they were people who needed to be hospitalized. We have, if you look at their map, you can see where other people are coming from. And we have people having to be sent to other states if we can find a bed. So, I just really, if I could say one thing, it's just that this is really a health issue. And the vaccination does work, and it helps us. And it's what we need to do to get us moved forward. I want my loved ones to be able to access care if they need it in our community where we are. I don't want to have to be worried that we're not going to have a hospital bed available for them. And I don't want to see our physicians and nurses taxed to the breaking point.
Okay, thanks.
Okay, with that, thank you for joining us today, and be sure to wear your mask, and please get vaccinated.